very proud to host this event here today. We are currently located in the Anderson Event Room at the Commerce Center. Our address is 9 North Federal Avenue, Mason City, Iowa. So without further ado, it is my pleasure to introduce the Executive Director of 43 North Iowa, John Berryberry.
Thank you. Thank you for coming out. What a wonderful turnout for the program that we're about to talk about. A couple things from 43 North Iowa at your table is our community report. Lovely that so many of you get to take a look at it today. It's about the services that we provide, the expansions that we're doing, and about how we want social work to be in and a part of the community. I do want to thank and highlight the staff. We hired Teresa Price 2 years ago, and she came on board and she got our mission, and she said one of the things that we do is we do social work in the community, but we don't have conversations with the community. And so this is the second year in a row that we are hosting an event with the community to talk about the type of social work that is occurring in Mason City. And these conversations are so important. So you as the community knows what is going on to help the people in need in our community. And so it was a wonderful idea, and obviously with this many people in the room, beautifully executed by Teresa. So we can give her a round of applause. Locally here, we've been working on a concept called community social work, and I think you will see over the next hour kind of what that means, which is no one agency is going to solve the complex needs that face Mason City and our community. And so we need to come together and turn to each other to use different resources and different avenues to problem solve and create avenues for success for every community member in North Iowa. And we're excited to talk about that today. And so we will get going. If you can put your cell phones on silent, unless you are an emergency responder and or the community crisis response person team member who is in the room with us today. So it would be poetic justice if she has to dash out for a phone call. And we'll spend the next hour talking about this program and leave time for you guys to have questions, because I'm sure there's some curiosity about launching a new program like this in North Iowa. But again, thanks for coming and looking forward to this.
Perfect. So I will be moderating the discussion, but you'll be hearing mostly from our panelists here today. Quickly, I'd like to have each of you introduce yourselves and share just briefly your role in the development or operation of the community crisis response team.
So you already know me. And my role is being the person at the table for 43 North Iowa and ensuring that we are a good partner and we're advocating our resources to this program, and we have staff involved. And so I'm overseeing the staff and making sure that we're all playing nice with each other as we roll out a really large program with multiple partners at the table.
Good afternoon. My name is Kelly Grunov, and I'm the current CEO at Fraser Ridge. I think from our standpoint, our prior CEO had actually had some conversations with the chief here about where we could fill some gaps for mobile crisis and community crisis. And then my role would be very similar to John's as far as ensuring that our staff are working in the way that we want to participate in community social work. And then we serve 13 counties. And so looking at what this looks like for our other 12 counties as we see success with this program.
Good afternoon, Jeff Brinkley, Mason City Police Chief. Thank you first for all of you for coming out today to join us. I've been in this role since January of 2016, working with many of you in the room on mental and behavioral health. And so my role in this, I think, is I would call squeaky wheel, for lack of a better term, because I have sat in meetings with many of you and lamented what's happening to our community in terms of how we address mental health. What the challenges are for our department, and the fact that it's become a retention issue. And you listen, and you talk to me, and you talk to our department, you talk to our staff, and you're willing to find partnerships and new tools and new approaches to try to solve problems here in our own backyard. And I really think that is the real value today, and the real strength of this program is that good ideas don't always have to come from Washington, D.C. or Des Moines, Iowa. They are right here with the people that are closest to the work. And so I think you're going to hear that come on today, and I appreciate you being here and continuing to work with us as we move ahead in that fashion.
I'm Karen Crimmings. I'm the Deputy Director for Sarasota County Department of Public Health, and I'm here with Chief Brinkley. Just said thank you all for coming. This is wonderful. We've been working on this for quite some time, so seeing it actually start is great. My role is really as a convener. With public health, we work with a lot of different partners and different populations, and knowing that this is something that was needed in our community, so we just started reaching out and getting people around the table to talk. We've got a lot of passionate people in our community and just bringing them all together so that we can make a really impactful program for our residents.
My name is Carl Gienap. When this project started, I was a deputy chief of EMS operations at the Mesa City Fire Department. I retired a year ago, and now I am a county supervisor. At the fire department, after working there 28 years, I identified the gaps in the system or the cracks in the system where people would fall through and the people that weren't being taken care of. Unknown to me, all these fine individuals here had identified these same items and were already working on a plan to fix them. But everybody was doing things independently. And through NIAPA, County Health, the police department, and everybody at the table plus more, it just shows that when everybody comes together for a common goal, the success is it's just amazing. And a lot of communities, you won't see this kind of cooperation across different departments. But here in Mesa City, we have a very unique situation where everybody gets along. We're all in it for a common goal, just not our own pocketbooks. And because of that, you'll see things happen here that you won't see happen anywhere else.
I agree, Carl. What I hear all the time is what's your secret sauce in Mason City, and it's in Sarasota County, and it's collaboration and working together and putting our egos aside sometimes. So we've heard their roles in the CCRT, but I'd like to hear a little bit more about exactly what the Community Crisis Response Team is. How did it start and how does it function day to day?
You got it.
So as far as the idea behind this, or the problem that we wanted to work on getting better, closer to a solution, was that mobile crisis was created. It was a legislative mandate a few years ago, and there's some really good people in the community, really good agencies working for mobilizing mobile crisis. And in fact, some of Prairie Ridge's duty as a certified community behavioral health center across the state is that we're required to assist in the oversight of mobile crisis, but there's a gap in it. We're very rural across North Iowa. So from the time a call comes in and law enforcement or other EMS is deployed, the mandate around that is for our urban areas an hour and our rural areas 2 hours. And some of it depends on what code you're going under, because it falls under a couple of different codes. But that's really not a great solution. 2 hours with an officer following a person down around who's in crisis, that maybe they're not sitting at their house, they're walking through a park or walking through downtown. And so looking at, is there a system that we can mobilize where somebody can be on site and the law enforcement officer can go back to the calls and the task that they're employed for, and we can get community mental health workers or social workers into that situation to try to de-escalate it. Mobile crisis might still be called. We might still be looking at that, employing that avenue. However, we'll cover the gap from like the 10 to 12 minute point to when mobile crisis arrives. And it's just another layer of assisting for folks who are in crisis.
Nothing.
Okay. An ad. So tell me about how it functions day to day. What does it look like for the user?
So the best way to describe this program is it's a 911 diversion program. So now in Sarasota County, when you call 911, you can get police, you can get fire, you can get EMS, you can get 43 North Iowa, which has access to crisis mental health beds, and you can get Prairie Ridge, which has access to substance abuse assistance. So when you are calling 911 in our community now, we now have 5 areas of expertise going out to assist people. And then those professionals are going to decide what is needed. If the police are needed, we'll wait back until it's safe. If it's just mental health, we'll go in and start doing it, and the police can go on. Our staff have access to dispatch, and so dispatch has worked with us to create programs and having us have access to 911 dispatch. As we roll this out over 6 months to a year, we're hoping that we feel safe enough that sometimes when 911's called, we can just send the mental health and substance abuse counselors if we feel it's safe and law enforcement doesn't have to respond, right? So it is about timely intervention, the right person at the right time in the right environment can mean the world for folks. This is just adding 2 people to the menu to expand our menu, and they are on call. One of the cool things about this program and how it's being funded currently is that our staff aren't in ratio. So there's no, the phone rings, wait, I gotta find someone to cover, I gotta, pull this program from here. Our staff aren't in ratio, so if the phone rings, they go. Just like we pay a firefighter, if there's a fire, you go, you don't wait for someone to replace you. And so this is treating mental health and substance abuse as an emergency, and our staff are free to go and be on scene as soon as possible. And that's probably the best part of this program, is that we have grants paying for staff to not do anything else but respond to these situations.
Perfect. Karen, I think I'll have you take this question as the convener. How did your partners come together around this idea? Was there a singular episode that sparked this, we have to actually get together and do something, or did it evolve over time? And what steps were taken to design a solution that works for us, a custom solution?
Yeah, I think the most noted event that took place is, I'm not sure if everyone's aware of NIAPA, which is North Iowa Addiction Prevention Alliance. I mess that one up every time. I call it NIAPA for a reason. So back in May of last year, we brought community members together and was really looking at what does our coalition want to focus on. And during that conversation, this idea came up of EMS struggling with calls, law enforcement struggling with calls, mobile crisis maybe not being there as quickly as we needed them. And so that was definitely an area where the group wanted to focus this year. And I believe all of us were in that strategic planning at one time. So, and then it just really evolved from there, and getting people to the table and talking and looking for some funding streams, and then really looking at, we know what we need now, how are we going to make it work, and doing that blueprint. So
Was there a moment as you were designing this that you maybe had a different idea of where this would head and then had to pivot, or how did that come together?
I think one of the first meetings that we had was really looking at a grant that to fit that, and that grant dissolved. And so we did have to change focus a little bit. At first we were like, okay, well, let's go look for some other money. And then it came to us that we've got resources here. Let's not wait for a grant to open up. Let's just get this going. And we can show funders and others in the state what this program can do. And then we're looking for somebody to come up and help support this as we continue on. But we definitely have enough for this pilot project, and we are having conversations behind the scenes. And I think there's going to be some really impactful outcomes that happen for the residents that really are in need of these services.
Right. So I'd love if someone could expand a little bit more on how this program is currently funded, and what are you thinking about as you think and consider sustaining and scaling this in the future?
Currently, the Board of Supervisors approved funds from the opioid settlement cases to fund this for 12 hours a day, 7 days a week. And that is paying the wages of people to be on duty during that time and able to respond. Now, luckily, 43 North Iowa and others were able to come up with grants, private donations. Civic groups have given donations towards this too, to come up with about 85,000 so basically a third of the cost, or a little under a third of the cost, which is amazing how the community stood up and to help such a worthwhile project. But currently the opioid funds cover the majority of it. The opioid funds are used for other projects too, quite a few of those at Prairie Ridge and Narcan distribution and other things like that. So it's not a long-term solution for this problem. But we decided as a group, we didn't want to wait until we had full funding because of the uncertainty of the grant situations and everything else that's happening around the country. We couldn't just wait. This is a need. We have the need. We have the patients that are falling through the cracks. We need to take care of it now. Every minute we wait, more people are going to get hurt. More people are not going to get the care that they need. And the traditional first responders aren't going to be able to do their job like normal because they're always backlogged with calls that they're not trained to do. So we do need funding for long-term. We are working with, talking with state legislatures to try to get in there to do some lobbying for this. Looking at, we're trying to get this to be a pilot program for the state to show if it works or not. So we need to give it our all. But otherwise, we still do not have permanent financing for this.
Got it. So Carl, you mentioned, you operate 12 hours a day, 7 days a week. However, as we all know, mental health crises don't operate just within 12 hours a day. It's a 24-hour a day issue. Jeff, maybe you can speak a little bit to how the hours were determined and how you expect them to change in the future.
Yeah, we, as a police department, have the ability with the technology that we use for computer-aided dispatch and our records management system to flag dispositions on all the calls for service that we're on. So we've been generating reports just for this group's use. Every day at 8 o'clock in the morning, we have a daily run report for all of our mental health issues from the day before that go out to our community partners. And so many of you in this room read that report every day. And so we've been very open about this communication for 7 or 8 years now, probably looking back on that. And we basically took that call data and put that on a calendar and a clock and figured out where the busy periods were. And so that 10 a.m. to 10 p.m. really seems to catch the bulk of our business. You're right, Colleen, there's obviously other times of the day that this happens, but this is also the goal for us in getting some good data together around the issue with what dispatch is doing at the sheriff's office and tracking all of that so that we know we're hitting the right points. And then if there's a 24-hour need, 2 teams during the day kind of need, we're gonna go try to seek that funding and build that out as well.
So I'd like to talk a little bit about how this works from the responder standpoint. So if a couple of you, because I think it's a little bit different depending on who the person is, talk about the training that responders receive to make sure that they're prepared for these situations, whether it's someone who is law enforcement, somebody who is a crisis responder. How does that look from the different partners?
Yeah, so just from the get-go, Heather Hahn and Sheriff Epperly are sitting in the back there. That's where it starts, is at the sheriff's office. When the call goes to 911 or a routine call comes in on one of our administrative lines about some kind of issue. So our past practice before yesterday was to send an officer and handle that. I'll just tell you up front, law enforcement is really good at crisis mental health. We're terrible at routine mental health. Like, we're not social workers. We don't have the resources. We don't have the knowledge. We don't have the interest, to be completely honest with you, to do that kind of work. And so we can send an officer out who isn't great at that, and I can talk to somebody and leave them where I found them with the same problems, but 2 hours later, they're gonna call in again. And we're gonna repeat that process over and over again. And that was a lot of what we were doing. We've trained our officers in mental health first aid. We've done de-escalation. We've provided the PERF program, implementing communication assessment and tactics. And those are great crisis tools, but they're not good routine mental health management tools. And so our job really is focused on stabilizing the incident if that needs to happen, and then really working to get the warm handoff here to Prairie Ridge and 43 North Iowa when people come to the scene that need behavioral health support. And I'll hand off to you guys.
I guess I know our supervisor who oversees this program, Cassandra, who was in the room, she looked at and collaborated with some of the 43 North staff to look at what we were doing for training. Both agencies use a database that's widely used within behavioral health called Relias that has a bunch of trainings. They're competency-based trainings. So and many of them, you have to watch the whole video. Your screen has to be up. You cannot put your email in front of it. You can't put other things in front of it. You have to have it open on your screen, and every, 30 seconds, hit forward so that you're actually watching it. Staff love it. I can see her shaking her head.
Live stream. Get back to it right now.
But talk through like what is out there. Relias as a company has created a bunch of really good trainings where the staff, they're not in person, and so, or you don't have a live person doing them, but they do have a lot of really good information, and they have to take a quiz on the end so that we know that they absorb some of the information. Our staff also is going through some of the trainings that our community-based staff already have to go to. So there's a training called Assist that is a suicide identification and intervention program that our staff will be going through, as well as the regular training that our staff on site go through. I think all the staff that we have, as well as your staff, were folks who have been in this industry at least for a little bit, going through trainings. One of our gals is very well versed in crises because of the initial job that she had when she worked at Prairie Ridge. And so looking at that, and I think the other thing from our perspective is adaptability. And so looking at, well, we thought the calls would be in regards to this because of 7 years of the police emails, but they're not. And so we're going to get the training to ensure that not only the staff are safe and feel well equipped to do their job, but also to make sure that we're meeting the needs of the folks that we're getting called out to. And then we actually have an internal process for follow-up. And so if a person is coming, we're getting a call for a person, we're trying to follow up to try to prevent the next crises, the next 911 call, if not necessary. There are times that we're not gonna stop the 911 call. There are times we want 911 to be called, but to do what we can to work with folks to take other avenues.
So we opened up a crisis stabilization a little over a year ago now, and that's a walk-in program. So our staff there have standards they have to meet where they have to do on-site de-escalation. We have clients walk in all sorts of different situations. So we based our training program for this program off of that, which is they have to have 2 years of experience, right? So you're not going on your first call being like, hey, I've never even asked anyone about suicide, because that will be an awkward conversation. And then they have 60 hours of training they have to complete, right? And then every year they have to do another 30 to stay in compliance, right? So we based it off of Iowa state code for crisis stabilization, and considering this an extension of crisis stabilization. And that's a good place to start. As this program develops and we get a better log of calls and understand what the needs are, we're obviously going to be flexible and work with Prairie Ridge to address the training program. And the police and Prairie Ridge and 43 North Iowa have met. And they're starting to get their feet under them about how we're gonna communicate and talk to each other. So the first 90 days, 180 days, there's gonna be a ton of kinks to iron out, and that will inform future training. But we feel like we have a good foot under our ground because we based it off of previous programs that already have state standards.
You know, one thing I really haven't heard yet is what do these situations look like? Jeff, you mentioned that, you know, you're not so good with the day-to-day mental health, but great with a real severe crisis. Share a little bit about what these situations may look like when someone calls.
Well, the program's up and running.
Yeah.
And so last night I got a phone call about 5:30, a staff apologizing that we just took in a dog for 12 hours. Because the person on the community crisis response team on the call and the police were trying to figure out how to get this person into the emergency room, and they said, I'll go if someone will take care of my dog, right? We have never boarded a dog at 42 North Iowa. I mean, we have now, maybe for the right price when you're on vacation, we'll do it again. It's gonna be high, we're a nonprofit, it's gonna be high. And so that was new for us, right? So it is about kind of meeting the needs. So we'll see what the phone calls are. We haven't been out in the community, but it's a really good story to start off on. And I'll pass it to Jeff so we can talk about what his officers say. But we have boarded a dog for 12 hours and no one got bit and everyone's good. So
I think it would be a good fundraising mechanism for this program. Take on dog boarding.
Yeah, we broke some new ground last night unintentionally. I think if you can imagine it, we've probably responded to it. You know, you think of a lonely senior citizen who hears noises in the night because they can't sleep, they're calling us. Somebody who's actively suicidal, pills, edged weapons, those kinds of things. It can be a family situation where we respond and we get into a behavioral health issue related to a family member. We might stumble into this on a domestic call. There's no cookie cutter answer for this. And sometimes we go and then discover the behavioral health issue when we get there. Dispatcher didn't pick up on it. The officer didn't know until we get in there. We start asking the questions. And so there's no script. I think it's going to be really interesting to see what the data rolls out here in the first 60, 90 days as we start making sense of it. We have our book of business that we've been talking about, like Kelly said, for the last few years. And that really is our baseline here. It's where we start. But I think how we move ahead will be interesting. But it's, there's no set way we find it. Sometimes it finds us. It walks in the front door of the police department and presents as, I need food, or I'm homeless, I don't have a place to go. You all experience these things in our community. You see people, we get calls, dispatch gets a 911 call, somebody's dancing on the corner of 13th and South Federal, or sitting there eating dirt and rocks. Though that's how behavioral health presents to us. And hopefully, that's the other side of this, I think, for us as a community, is getting some good education about what behavioral health looks like in reality, not being afraid of it, but understanding it, and then understanding it's not necessarily a police problem, but it's a community problem. And so when we can get social workers there to actively address these issues, provide resources to people that need them, we can really make a difference, because there are a lot of good success stories as well. They just don't get told as often.
So talk a little bit about how this team, you've shown up to a call, how do you coordinate during call and after the call has concluded with each other, with your law enforcement, but also with, say, Mercy One, the hospital, other community organizations? How does this feed into the greater mission of what 43 North Iowa, Prairie Ridge Public Health can do and offer people in these situations?
Yeah, for us, it's figuring out if there's a law enforcement nexus when we get there, handling that, whatever it is. Most cases we'll be able to hand off to the team. There may be a time where we have to make an arrest because somebody has an arrest warrant, or some other incidents happen, maybe a domestic, where we have a mandatory arrest issue. It doesn't mean we can't leave the team there to try to pick that up. The one caveat, this is probably a great question, Colleen, is we do not dispatch to active suicide attempt. So we've made the decision that if there's likely to be a medical transport, we're not gonna send the team to that, because we're gonna transport to Mercy. And so there's just not a role for the team there. But we're trying to get the team involved as that person is discharged from the hospital, to not put them back into the same situation that they were at the start. And so hopefully we don't end up back there again. But our officers will wrap up essentially their part, figure out if there's a law enforcement nexus, and if there's not, we'll hang tight with the person until the team arrives, do a warm handoff. We've had the CCRT members in for meet and greets at the police department, so we at least have laid eyes on one another and have a pretty idea who's probably coming to the call. And we'll continue to build those everyday relationships, and then we'll hand off to them and let them start to work their magic and bring their skill set and resources to the scene to help.
I think from Prairie Ridge's perspective, Angela, who helps get your food out to you, she created, she's 43 North Iowa, not Prairie Ridge, but she helped create a couple of what I would call modules, like worksheets and intervention sheets for, I think, probably some of the situations that we can probably assume are gonna happen sooner or later. I don't know that they happened in the 4 calls yesterday or the one this morning, but like just that tool for staff. I think one thing that some of our folks need, that they just need something to help ground them. So having, even if it's a worksheet to go over with them with staff, and then they can keep that when we walk away. Also, as I mentioned earlier, we really do want to look at how we prevent the next 911 call that maybe is behavioral health related and not necessarily a law enforcement issue. Is how are we going to connect people to the community? So we also, our staff have releases where we can sign releases. So because we're healthcare facilities, we do have federal laws that we have to maintain confidentiality. So signing those releases so that the next day or later that day, we can reach out to folks and make those connections for referrals, so that person, if they need services, can get into services somewhere in the community. And then we have permission to do some level of follow-up. And then 43 North staff also can transport patients, and so the 2 staff person, people that are working while having a vehicle together, if the person needs to go somewhere, if they determine that they're gonna come over to crisis stabilization, if they need to go to the emergency room or behavioral health unit and it's not an ambulance related issue, they discuss some of that as far as how they're gonna do that connection. And so I think from Prairie Ridge's standpoint, our staff will do what they can in the moment, stabilize the person, try to prevent that next 911 call, and then work on that follow-up. Where does the case management and the service navigation come in after the call is resolved?
What she said.
You get it next.
So I'm thinking about this from a patient perspective and or a person that you're responding to's perspective. How is the service paid for in terms of if they have insurance, if they have Medicare? This is a lot of, there are people who may not reach out for mental health help because they feel they don't have the financial resources to be able to support that, because it does have a cost associated with it. How does that work for them? Do they end up having to pay for the service, to all this transportation from one to another? What does it look like?
No, so as far as the staff who are working on the team, it's the county money that has been allocated, and then the grants that 43 North has received that will pay for that. I think from the perspective from what happens after that, so say we do call mobile crisis and mobile crisis comes out, because they do have a little bit different level of training. And I guess from our perspective, because we're required to help oversee mobile crisis, we just want to fill the gap. We're not looking to replace another, we don't want to duplicate services by any means. They either get paid through the Medicaid organizations or the ASOs, so the new behavioral health system through the state. And then I think we all have different funding mechanisms. So we have insurance, we have grants from Prairie Ridge, so that person comes into services at Prairie Ridge. We are a safety net provider. We don't turn people away based off of inability to pay for services. And so we're just, I guess we've been doing it for years and years to figure out where the funder of last resort is for those patients. If they don't have Medicaid, but they would qualify, we have staff who fill out the application with them. So, and I know your funding is just a little different than ours.
Yeah, I mean, we operate in the same philosophy. So once someone's in our services, we are obviously trying to get them set up what they're eligible for. And there's income eligibility issues that we resolve for staff. There is some small clients that private pay, but that's very rare. And when they do, it has always worked out based on a sliding ski fail. But using community crisis response team and having us show up on scene will not cost anyone anything. It's after we get into case management, excuse me, and 98% of the time they're walking away, getting the services they need to get on their feet to be a part of the community with not owing anyone anything. And we want to continue that tradition because it's really bad to say to someone, I want help. Yep, I'd be glad to help you. Can you slide me a 50? Like it just automatically becomes a barrier. And so our job as community providers is to lower those barriers as low as possible. So people feel like they have the avenue to get healthier and participate in society.
Karen, I think I'll ask you this. Do you think that as we're removing these barriers, as we're taking away any funding that will come with it, taking away the scary presence of a police officer showing up at your door and thinking you're going to be under arrest, and as this program becomes more well-known in the community, do you anticipate that you'll be getting more calls from people who maybe otherwise would not have called or would not have sought out help in these situations because they know what might show up at their door?
Yeah, I hope so. And as this program continues to go through the community, that trust build up and people being able to witness what the outcomes are and the services that are provided from these organizations. I feel like people are going to start reaching out a little bit more that maybe were a little hesitant before. Our community embracing mental health and substance use and making sure that people know that we care about them. That goes a major way. When you just say, you know what, we care about you, they're gonna reach out and ask for the help that they need, for sure.
Yeah, because I can imagine a situation where maybe you're not the person that's in the emergency, but your brother or your husband or your child is, and you don't want to have to call the cops. Because there's a stigma around that. If you're gonna, I don't want to call 911 on my brother, but if I'm calling and I know that it's not an arrest that's gonna happen, but help that's gonna happen, I think that would really shift the thinking around this, right?
Absolutely. We have programs at Public Health, and I'm sure these organizations do too, where once you are able to demonstrate that the services that you're providing is trustworthy, that you only want the best for them, that goes a long way in them reaching out to their friends and their family, and that gives them the okay that this organization's okay to work with, and they want only what's best for us.
Carl, share a little bit about how this team will measure success and how do we know that we're making a difference? I know we're on day one, but I'm sure you've thought ahead of that.
You've solved all the problems.
I'm sure you have, yeah. So we can just leave. We're done. No, great lunch. Share a little bit about what success looks like with this program and how you're going to measure that.
Well, first of all, the easiest thing to measure is how it affects law enforcement and other traditional first responders like fire and EMS. Is it taking a load off of them, allowing them more time to do more traditional police work and traditional EMS work? That's an easy thing to measure because of all the reports done for every single call. Now, the bigger picture is taking care of people, obviously, and doing it responsibly. If we are able to get people into services earlier in a crisis than later, in theory, they should be able to go into a lower level of treatment and be released or at least downgraded to a lower level yet over time. When if you don't get these services to people early enough, it could end up being 90 days in inpatient and then released to different agencies like we have here, and costing the taxpayers a significant amount of money through Medicare, Medicaid. And if we can hit that earlier, we can decrease that total amount of tax money spent. Because that's the big thing I always get. Well, who's paying for this? Because it's not free to have employees. It's not free to have a van. It's not free to go out and take care of people. It costs money. And currently, there are no tax dollars going into this. It's opioid funding and private and other grants. So not saying it'll be that way in the future, because we need sustainability. But if we can prove that it is saving money by getting people into services earlier in the big picture, it'll be an easier sell.
Connie,
Yeah.
I think those of you who work in mental health in our community, in our region, we always, I've experienced this as a return to Mason City in this role, that we definitely have a heavier lift here in Mason City because of the 8 counties that surround us. So that was one of the really key things. We worked with Karen early on. We're going to track county of origin for people that we interact with in the team environment here. And I think there's a real two real important issues there. One, we have enough resources for our own backyard, but we cannot take care of everyone else. And we have to figure out how to either leverage that financial relationship with their home county or someone else, or get them back to where they're from when they're done getting treatment here, so that our bucket doesn't spill. Because we're really I feel like we're at a kind of a critical mass of what we can do locally, and we're trying to do that really well for the people who are our responsibility. But I don't feel like everyone else in the state is Mason City and Saratoga County's responsibility. So we've got to get some help. And so this data piece of this, I think, is going to be really interesting. I think down the road, I don't think any of us have a problem making an ask of a bordering county. Hey, your people are 10% of our load. This is what this costs. We've got to figure this out. And I think that's a real conversation that I think they know is probably coming, but I think we're willing to have as well, because we're going to have good data to support it.
If you're talking about measuring success, I want to go back to a couple of things that we have to highlight some other partners. So I think the last 2 years, Mercy, which does a community needs assessment, the number one has been mental health access, right? This is a response to that, and that is a wonderful survey of the area. The police data that we use for crisis stabilization was roughly like 55 to 60% of the phone calls have some sort of mental health capacity. So this wasn't like thought up in thin air. And then the other thing that I think we have to understand as a community is that if we do partnerships like this, some of the success is relieving the stress of the system. A cop that is 5% less stressed because they know Prairie Ridge and 43 North Iowa showing up is going to do a 5% better job. The emergency room doctors might know that, hey, 43 is sitting with the client in the waiting room and they know how to de-escalate, and so it's not such an emergency. And if the system is less stressed, the system operates better, right? We want our cops, our emergency personnel arriving on scenes knowing that, like, I'm in a good space. So partly for me, for the success is, does the retention rate of police officers and sheriffs go up?
Yeah.
Right? And are they reporting that they like their job better, right? Because our clients, 85% of the time, are a victim of crime. They're not the one doing the crime, right? And so if they're doing policing work and there's less crime in Mason City, there's less need for our clients to go into crisis. So this really is about service providers come alongside a fire department, police department, EMS, emergency room folks, and saying, we need to do better at relieving your stress so you can do your job, and then we can lessen the stress on the whole system. And I think that's hopefully what we see. So it's not really in how many calls we go on or how many clients we get into 43 North Iowa. I want to hear from the police officers and fire department, I like my job better, right? Like I feel like the community is responding to make the emergency room nurse's job easier when that patient comes in with schizophrenia, right? Just knowing someone's there with you is a huge thing for us. And when this has happened, we see usually good results because people are less stressed. And so for us, we've talked a lot about this, an outcome measure is really getting the feedback from the people that we're riding along with or showing up with, that they're saying, I feel better about policing in Mason City. We do that, we'll take better care of the clients just because we're all happier. What a shock, right? That everyone's a little bit happier, and then we show up and we're a little bit nicer to that client, right? We're a little bit nicer to that community member. And for the public, when they see the person dancing on the street corner and they're like, oh, I should call this in, they'll go, we have a healthy response team and I know it's going to be okay. And we're actually responding to those community needs assessments and not just going, well, I wish we had the money to do that, right? We're actually trying to put some plans in action. So that for us is a huge thing of success, and we hope to see that over the next, hopefully 5 years as we get funding to run this program as long as possible.
So John, I know you said that more clients into 43 North Iowa is not the measure of success, but talk to me about how this program does kind of work in the map of what your clients offer to your clients.
So I mean, once you're in Prairie Ridge's system or in our system, we have a responsibility to start offering services, right? And we have an array of services between the two agencies, and then we also have array of partnerships with Northern Lights, with Friends of the Family, with crisis services, right? So once we're on these calls, you can start talking to people about an array of services. For some folks, they'll say, I don't want to leave my home. I got a program for that. If you have a mental health diagnosis and you don't want to move, I have a supported community living program that can come into that house and help. Prairie Ridge has got the ACT team, so if you qualify for that, you don't have to move. You can get mental health in your health. And I don't think a lot of people understand that. And so by them being in our services, they get access to every service that is partnered with Prairie Ridge and 43 North Iowa. And then sometimes it's reps, right? We know the people that we see around town that are always in crisis. They might not come in on that 5th call, but that 10th call, we might finally say the right thing, and they might go, 3 meals and a roof over my head at crisis stabilization sounds pretty good, right? And then now they're in our services, and then we can do a walk-in appointment at Prairie Ridge, and then we're off and running, right? And so meeting people where they are and bringing them to the service is just hopefully going to be more effective. So it's a wonderful program because the second we show up on call, they have access to pretty much every service that is offered in North Iowa if they're willing to sign the release. And it's a lot easier to sign the release on your own front lawn.
Yeah.
Right? Any other comments?
So be prepared. I'm going to open it up for questions from all of you because I'm sure you have questions as well. So as you're thinking of those, as you look around, we are filled with a room of community members, organizations who want to support what you're doing. How can the general public and the people who are in these businesses, agencies support what you're doing?
We accept cash, card, credit, whatever you have, pocket change. Teresa's back there, she'll process it. No, dog kennels, because apparently we need some in the back. Well played. So for me, it is obviously talking to local leaders and local providers about coming to the table and continuing to partner, and that we need to create a large network for folks, so there's no wrong door, right? The other thing is talking to our local reps about trying to get permanent funding for something like this and proof of concept, and talking to them about it. The other thing is within in Mason City, making sure that we are communicating to folks that the social work happening in Mason City is innovative. It is trying to solve the problem, and that there are a lot of good agencies doing the work to make this a wonderful place to live. And people need to know about it. So if you just go, if the only thing you do is leave here and say, Mason City, Iowa, Saragordo County has a 911 diversion program, and it's one of the first of a kind in its state, that's gonna be a lot. That's gonna perk some eyes up about the work that is being done to make this a safe community for everybody, right? And that's the point of social work, is making the client safe and the community safer so they don't go into crisis again.
I really don't have anything to add to that. Thank you.
I think keep telling the story for us. You as our community advocates are our biggest cheerleaders, where you can shed some light on what we're doing for people that maybe don't know or haven't had the opportunity to hear. I think that's always helpful. When you give us feedback, that's super helpful. I always enjoy sharing with our staff when I get a message from somebody in the community on a call this is what happened, this is what I appreciate about what your officers did. Anytime I can reinforce that behavior, that's awesome. That's gold in our agency. The thing I would say is, just help us, and there's a couple of them in the room, Doug Campbell's here, Christian Hermanson are here, reach out to your local electeds, as they, the Board of Supervisors, tell them thank you for some of the work that they do, because this is not easy lift stuff. These are not easy funding decisions and finite budgets. But share your personal perspective with them about what you've seen or what you've experienced or what you know, because I think that goes a long way as we try to make good decisions for our community.
Same thing everybody else said, but also we have another county supervisor and council member at the very back of the room too. Always reach out to your elected officials whenever you have concerns, comments, or anything. We have several in the room here today. Otherwise, you go online, you can find their contact information. Without input from the public, it's hard to make informed decisions.
And if I can add to that, as you're, if you are, say, stopping and chatting with Senator Campbell or Representative Christensen or one of our electeds, don't just tell them that this is something that you support or that you want to see funding for, because they know that. Tell them their story. Tell them why. If it's something that's personal that's happened to you or something that you've seen that impacts your business or impacts your community, tell them the personal story of why it's important to you, because those are things they can use to tell our story as a region when they go down to the State House and try to talk about the need for funding or the success of these programs, not just saying like, hey, we think it's working, but here's what we've seen so far. So just a little tip there. Your turn to ask questions or provide some feedback or thoughts that you've heard today. Who'd like to be the first? Yeah.
Thank you all for this. This is great. In addition to word of mouth, which of course is valuable, is there a concerted effort to more broadly promote this to the community at large? Or is it a little too early since we're still in the development stages for that?
So if anyone didn't hear, the question is there a way to advertise this more broadly to the community at large, even though it's a little bit?
I can start. We are releasing a press release next week, and the annual report that just went out. A lot of the calls are going to be filtered through dispatch to begin with, so the individuals that will utilize these services will be calling the 911. But yeah, we are going to be doing a press release and releasing some information that way.
We're doing a radio tour over the next couple of weeks, booking some morning shows and gonna talk. That was just decided at NIAPA yesterday morning. So for those that didn't hear, we're doing, NIAPA yesterday talked about making sure that a couple of us are reaching out to the radio stations and getting on the radio waves and talking about this. So we're gonna make a concerted effort to continue to educate people from this and about this. And then next week, Thursday, if you're all free, from 4 to 7, there will be an open house for the new RCF PMI and the Globe Gazette. And we're gonna have information about that and all of our programs, but Community Crisis Response Team will be at that program. Chief Brinkley's also letting me do a parade. I don't know why, but I'm so excited about this. So from 3 to 4, we're walking from the old RCF to the new RCF with our clients and staff and community members and filming a really, really fun video. Because social work should be fun every once in a while. We should celebrate expanding and bringing new programs online. It doesn't always have to be Debbie Downer. And we'll be sharing information at that event with the community about the CCRT team as well.
And if I might suggest, if any of you are in service clubs or community organizations where you'd like them to come speak to your group, I'm sure any one of them would be willing to do so.
What role might Region 3 play in more stable funding, given, I think the advisory group met last week and reconfirmed accessibility to be a high profile priority?
I think over time to communicate, I'm actually on an advisory committee for Region 2, which I know doesn't count for Region 3. But that I think those open lines of communication about what is going on, because that is some of what we're having our regional ASO meetings about, is looking at where there are gaps. One thing that's been identified is that across the 99 counties, we haven't always done mental health consistently. through the prior region system. And so I think keeping those lines of communication open, and I know you work through disability more than the ASO, but I have a meeting coming up with the person who is assigned to Cerro Gordo County. And so we will be talking about that and what makes us different.
Can you share what District 2 versus District 3
Yeah.
is other than the
So-
Hunger Games? That's what I'm
Yeah,
thinking.
sorry. This is real fun. So the area service organizations, so some of you are familiar with the prior mental health and disability regions that was the state set up for local funding and structure for mental health, the mental health system. And with the redesign that was implemented through the state on July 1st, we have area service organizations. And so each of our counties are broken up into different regions, and we happen to sit in area 3. I think there's a little more, and I know there's a little more direction this time as far as what we can fund, and the legislature really wants us to have consistent services across the state. So if I'm in Cerro Gordo County, or if I'm in Lyon County or Polk County, I should have access and availability to the same services, and the agency should be working towards towards a greater common goal. And so through that, District 3 is where Cerro Gordo County sits, and there is an advisory committee that meets several times a year. Community members can get in on that, but the advisory committee themselves are working on putting together a needs assessment and looking at where we need to fill the gaps in their service region.
Ken, great question. Yeah, I sit on the advisory, no, it's okay. I sit in the advisory committee for District 3, and actually Monday, we're hosting a meeting with Ashley Marciniak, who's our district lead, and several people in this room who are part of organizations because they know about the work that we're doing here. And they have questions about how do we get here. I think John will tell you, he goes to state meetings where other leaders of similar organizations are talking about this, and they don't have people sitting shoulder to shoulder like this solving community problems anywhere else. So I think they're excited to hear about what we're doing. We are certainly going to share this story and let them know that long-term funding is our goal. And I think John said it best yesterday as we were talking to the electeds at the state level. We intend to bring you a project that's proven for you to fund rather than you funding a project that we set out to prove that it works. And I think that's really our goal.
Traditionally, the gap between intoxicated people under the influence, was back of a cop car to the emergency room. I'm interested to know, how this might change that interface.
Yeah, sure. So crisis stabilization is allowed to take intoxicated people. If they are under a level where they kind of know what they're signing because they have to sign the release that they're going to be in services, and there's a little wiggle room with that. And so it's a conversation with that person and the police officer. We've worked with the police officers to sometimes take people who are under the influence. We don't often know what people come into crisis stabilization with. We also have a great partnership with the police department where we said, look, we think this person's too intoxicated, take them to Mercy. If Mercy clears them medically, we will come pick them up, and that has happened on a couple of occasions. So it's an ongoing conversation about safety of staff, safety of clients, and making sure that they're in the right place so we don't have any bad outcomes. So it's more of a conversation than it used to be. Doesn't mean that they don't get transported back to the cop car, doesn't mean they can't be transported with us, but it is now a conversation, not a set rule. Which is a little gray and can confuse staff, but we navigate as best we can. But it's worked well for us since crisis is open. We're doing the same thing with crisis, the transporting people with the response team. Who is the right person to transport? What is the right message to send to this client? And how do we get them where they want to go safely? Sometimes that's the cops, sometimes it can be us.
I spent my professional life as a middle school guidance counselor, and let me applaud and say to all of you, you should feel very, very proud of what you have done, because I am sure you were plenty busy before this particular idea started sprouting and spreading, and you are believers and servers, and yes, healthier families have got to include the kids. where do schools fall in terms of your educating your fellow adults about the program? And, I don't know how to ask the question, but maybe you're catching my drift here as to what,
So 43 North Iowa is in the state, we're only licensed to do 18 years and older.
Oh.
Right?
Okay.
And that doesn't mean that if this goes well and we see a need to expand this down to under the underage population, we wouldn't entertain that. But from our perspective, we are experts on adults. And we don't want to go into something, a brand new program, trying to become experts on kid intervention when it's not us. Is there someone else that could join CCRT as this expands that could be an expert in kids and they're responding to kid calls? Do we need to eventually venture into maybe, hey, we're gonna take it down to kids? You're right, there's a need. It just wasn't, not something that we can currently do, but we're gonna continue to evaluate to see how do we expand this to everyone in the community. And it'll be interesting to see how that unfolds. But the kids currently are not in this pilot program. We hope so someday.
and, I would suggest that you include school administrators if you're ever developing a list of, we're gonna wanna make speeches here or there or there or here or however it is. And lastly, I have 2 dog pets.
Angela, get her name, just so.
See a through line happening here. Who has the next question? Yes.
You alluded to this a little bit in your talk, John, but administratively, is 43 North Iowa taking future donations and contributions to this? Are they handling that arm?
Yeah, so we administratively, both Prairie Ridge and 43 North Iowa are donating the administrative costs. So the money that we are raising are just for the staff operating the program. And so that is an in-kind donation from 2 nonprofits to get this off the ground. We are still raising money for this program. The $85,000 that we have raised does not cover our whole year staff, and we're trying to save the opioid money, right? So if we get the whole program funded, the opioid money might still be there, and we might get 2 years of funding while we're negotiating with how to get this paid full time. So the more donations we receive on this, the longer it takes us to tap into that opioid money, which means the longer it lasts, and then we can run this and have more data and more proof of what's working, iron out the kinks, right? So, and people can earmark the donation specifically to this program.
Great question, thank you. Who else has a question? Yes, go ahead.
So I know you mentioned 18 and under for 43 North Iowa is not currently an option. As far as that gap between, let's say, if a mobile crisis arrives, we can help with youth. I mean, is there still that divergent gap coverage? Is there still a connection into Prairie Ridge for some of their services under 18? Can you speak to that?
Yeah, absolutely. So right now, if it's an under 18 person that's involved in a 911 call, the community crisis team would not be deployed. They wouldn't be sent out. However, mobile crisis could be. We also on staff, we do have multiple school districts that we partner with. We serve the lifespan, both for psychiatric counseling, mental health, and substance use disorder services. So we could get somebody connected to a clinician, depending on the school district. We have, somebody told me just recently across our 13 counties, it's like 109 school buildings. So we don't have a clinician in every school building by any means, but schools are great at partnering and helping us do telehealth so we can expand the reach of any clinician by doing some telehealth into the school. And we also have a child psychiatrist, Dr. Williams, and so we can make those connections to those services, yes. And I know we get, again, through mobile crisis, we get a report every single day from the Irely Ball staff at Prairie Ridge of every mobile crisis dispatch that they had in our 13 county area. And so we follow up on that. We have a full-time staff person whose job is to follow up on all the mobile crisis calls that came in from the day before. So we will make those connections just separate from this team.
Any other questions that we have back here? Don't be shy. Okay, seeing none, I have one last question for each of you, if you could try to respond to it as we're kind of reflecting on this day. You're one day into deployment, but many months, couple of years into work on this effort, years in the making. How are you feeling today as you've launched this program? And a year from now, what do you hope the results are, either for the people you serve, for your organization, or for our community? You want to go first?
I hope in a year from now, that this is on the road to being 24/7. We have another partner at the table that is talking about joining for doing with children and going to the local schools for these situations. But more importantly, I hope we have a lot more funny stories about dogs. And we have a lot more conversations versus police officers and social workers, and the community feels like we have places to turn when things are going sideways in North Iowa. The reason why 43 North Iowa does this work, from the board of directors through me, through my staff, is because we have numerous clients with needs and we can't solve them all. We have found over the last 6 years, with an extremely wonderful partnership with Prairie Ridge and the police department, that we are getting better outcomes with Mercy, with community health, because we are having these difficult conversations about how to share clients. Because Chief Brinkley and I talk all the time, like, we have the same clientele, right? And so that we're here for that. So we continue to have a better, safer community for everyone. Our people are taken care of, it's safer for you. And everyone enjoys living here better. So ultimately, that's what I want. Just funnier conversations around social work, people understanding it's happy, and a lot of conversations about what we're doing right in Mason City for our most vulnerable, instead of harping on the stuff that we're not doing. Because there's a lot going right in this community. I'm very proud to be a part of this team and a couple other teams that are doing very, very good work in very, very stressful situations.
Thanks, John. Kelly, thoughts on your feelings today and your hopes for a year from now?
Yeah, I would echo a lot of what John said, and I think just the community collaboration. So even if long-term it's Prairie Ridge and 43 North that's dispatched to these calls, that we have a lot more community partners involved in the start to finish. And so looking at what toolbox we're filling up for the people that we serve, our patients, who are we giving them access to? We can't be everything to everyone, and there are people truly that need the services that we provide, that just aren't philosophically going to be a good fit for Prairie Ridge or 43 North. And so having that toolbox so that we can get those folks where they need to be, so that they're not living in crisis, or if they are, they know where to turn to and they have the confidence for that, which comes from relationship building, both in this room but also out in the community with the people that we serve. I think, to echo the conversation about retention with law enforcement, I think providing hope for our staff and our patients will help with retention too. We have lost some staff over the years, saying that they just didn't feel like they were helping as much as they thought they could when they came into social work or substance use disorder treatment or mental health services. And so providing this next level of service, I think will not only help with law enforcement and EMS, but I think it will help with our staff who went into this field to help people. I know your folks did too, but in a different way. And so I think that the community level, but also the staff level, I think is going to be important, and just maintaining the hope in the community.
Yeah, so I'm gonna be completely honest. This is a little bit reflective for me, just as my retirement is coming up next month, but I'll tell you, we have a lot of really good young police officers in our building, and they get mental health. They get it really well. They do it really well. They are empathetic. They are interested. They are not my generation of police officers dealing with mental health. And for that, I'm grateful, but I'm also a little bit wishing I was a rookie again, because I'm really excited about what the future looks like. Not just with this, but with some other technology things that we're starting to do as a department. And I think that'll be, I won't get to see that every day. That's the part I'll miss, but I'm hopeful a year from now that the statistics are showing exactly what I think they're gonna show, that we've secured funding for a 24-hour-a-day operation, and that our officers, their well-being, their mental health, their commitment to our community is as high as it's ever been, because all of you are telling the story. We're all partnering together and making a real difference, and that we've got a pile of stories to tell you, names missing, obviously, but of success stories that we've been able to capture over the last 12 months.
And he might hire you back. That's a rookie. His resume pass muster?
I'm feeling very hopeful and excited, really being part of this group and seeing in a year from now, decreased burnout and fatigue from people that are working within this field. And most all is seeing those individuals that are hurting in our community and actually getting services that will help them succeed. You see or hear about the individual success stories, and there's so much, they're just heartfelt to listen to, and I hope there's a lot more of those here. I've been born and raised here in Mason City, and it's truly it means a lot to me, this community does, and having leaders like this work on something and having all of you show up to hear about it, it really touches me, so thank you very much.
Well, that's a really hard act to follow, what everybody said there. So I would just like to say, a year from now, I would like to be able to prove our success by showing that we're bringing people into services early enough that they are not becoming as sick or as needing as extensive of services as they would have without us. I would like to see full 24 hours a day coverage with whatever staffing levels needed for the amount of calls. And ultimately, it will make Mason City and Sarasota County a better place to live, a better place to raise a family, and just a safer community.
Thank you. Thanks to all 5 of you for your time. Thank you all for coming and listening and caring about this issue, about the services that are provided by all of these organizations, and for 43 North Iowa for helping to be this kind of convener and getting everyone together. So let's give a round of applause for us.
One shout out. I want to give a shout out to Heather Hahn as well with dispatch. This is not an easy thing to accomplish behind the scenes, and you're the lifeline to those individuals in the community. So thank you for making this happen too.
Closing remarks?
So we talked data, we talked why we're doing this. I want to tell one specific story about what does it mean to get outcomes in community social work. We opened up the crisis stabilization. We have told our staff, admit. If someone comes in and they're a little bit of struggling, get them off the street, right? And our staff admitted somebody, and immediately they called their supervisor, something's off. Something's not right about this case. We're scared that maybe we admitted the wrong person, something doesn't feel right. And immediately we're like, call the police. And they're like, are you sure? And I'm like, yeah, they're on our team, guys. And they called the police. We were spending probably 4 hours of convincing this person to stay in crisis stabilization. My staff are killing it. Just convincing this person who is frantic and confused and scared, and staying in services. The police show up, we get a proper ID. It's a 15-year-old runaway, right? And then they go with the police, and we know the outcomes of 15-year-old runaways. Now, I don't know what happened to this. We won't know what happened to this young person. But because of community social work, because my staff know that the police are on our side, we made the phone call. It wasn't, though, someone's going to be arrested, someone's in trouble, that we trust the police to do the right thing here in Sarasota County, that we were able to get that person to the right people, back to their family or back to their foster family, and off the streets. That's why you have to do community social work. That's why we need each other, right? It's great to talk about the data and all of those things, but that's where the rubber meets the road, is that when we're in crisis, we call each other and use each other's skill sets to get the job done. and you lower all of those barriers because you're using the entire toolbox. And we're gonna do that, and we're gonna keep doing it until we solve a lot of problems here locally. And I'm very, very excited about that. So thank you for coming. Wanted to leave you with that story so you know that this stuff is happening. We're not just BSing up here. There is real live stuff happening in Mason City around care about people and protecting really good outcomes. Please come to the parade. We'd love to have you all there to march with us. It's going to be fun. If you can't come to the parade, come to the open house and check out a brand new 15-bed mental health facility that's going to expand access by 3 beds. And it's a beautiful building. And so we're going to be able to help people there. Over the last 3 years, 43 North Iowa has raised locally or our own money or through grants, $6 million to expand mental health access and supports in North Iowa to the tune of 22 to 25%. With CCRT and some other programs, we think we're going to bump that up to 30%. And Prairie Ridge and 43 North Iowa roughly share probably about 55, 60 cases. And easily, and before 2019, that was roughly probably 10. So you're seeing the results of people lowering their ego and being like, we can help each other. And we want that to go throughout the entire community. So thank you for coming today. Have a good rest of your afternoon. Hopefully we'll see you next week at the big grand opening. Take care.